Well, this holiday weekend, many people hope to enjoy the sun. But before you head out, don't forget your sunscreen.
Yeah, skin cancer is the most common type of cancer, but also the most preventable. And it's a G thing.
G Thing, brought to you by Northwell, who believes when we raise health, we raise everyone. Northwell, raise health.
Soaking in the sun, there's nothing like it, right?
I was a sun worshiper.
Colleen grew up outdoors, horseback riding, boating, and skiing.
The worst sunburn I've ever had on my face came from skiing in the spring. I never really thought much about getting skin cancer.
And while she never thought she'd get skin cancer, Colleen did go for her yearly dermatology appointments, and during a self-exam, that's when she realized that something was off.
I did notice something on the back of my leg, which was small, but I was worried about the pigmentation of it, and I was kind of watching it and thinking to myself, I hope this is not a problem.
Her doctor diagnosed her with skin cancer and said that she may want to consult a plastic surgeon. That's when she reached out to Dr. Neil Tanner at Northwell Health.
Why did she need surgery if there's something on her leg?
In a procedure, you have to remove that involved area of skin as well as a normal margin of healthy skin. When you're losing a part of the skin, you have to fill that void.
I was relying on him to save my life because when you hear melanoma, if you let it spread, it has a 30% survival rate.
What is Colleen's prognosis now?
She has a great prognosis, and it really is attributable to what she said. It's early intervention.
Skin cancer is the most common type of cancer, but the most preventable. Dr. Tanner says everyone needs to be aware that sun exposure is our strongest risk factor.
I think it's important to point out that, when we're talking about minimizing sun exposure or using sunscreens, that's something that has to happen 365 days a year. When you're looking at purchasing a sunscreen, you want to make sure that it covers both UVA and UVB. Those are the types of UV radiation. And it should be SPF 15 or higher.
As for Colleen, her skin diagnosis was a wake-up call.
I wear sunscreen. I just try to be careful. I actually go to the dermatologist every 3 months now. I do my self-checks.
Words of wisdom for all to follow.
And if you'd like more information and tips on how to prevent skin cancer, you can head to the website northwell.edu/skin-cancer.